Welcome to Himalayan Kitchen, the venue for our inaugural resident QuizMania. We commence the quiz from the general round, where the quiz master will ask 6 general questions from different topics and areas of oral pathology. This is a multiple-choice question round, which is non-transferable. The first set of questions will be asked to Team A and followed by the other teams. 10 seconds will be allotted for each participant to answer the question on their first try and 5 seconds for their second try. The one to answer correctly will get 10 points on the first attempt and 5 points on the second attempt. There will be no deduction for the wrong answer. In the sample question, if the team answers option D on their first try, they can go for the second attempt. Now, if they answer option A, they will be awarded plus 5 points. The second round will be choice round, where there will be 6 topics that a participant can choose from for which he or she feels comfortable with the topic. The topics for this round are: A. Developmental anomaly and developmental conditions. B. Odontogenic cysts and tumors. C. Salivary gland diseases in oral cavity. D. Vesiculobulous lesion of the oral cavity. E. Bone lesions in the oral cavity. F. Hereditary conditions. Note, the topics are subjected to change, and these are just the examples of some common topics. There will be a total of 12 questions in this round. The questions will be asked to individual team, starting from Team A to Team F and back from Team F to Team A to conclude the round. Suppose if Team A chooses topic developmental anomaly for the first time, they will not be allowed to choose the same topic for the second time and need to choose from the rest of the 5 topics. The same rule goes to the other team as well. This is a passable round where 10 seconds will be given for the first team to answer and 5 seconds for the next team if the question is passed. The team to answer direct questions will be allotted 10 points and 5 points will be awarded to the team to answer the passed question. No negative marking will be there for the team attempting for the wrong answer or passing the question. Sample question if the team chooses the topic: Developmental anomaly and developmental conditions. What is an enamel defect resulting from incomplete formation of the enamel matrix called? Enamel hypoplasia. The third round is the visual round, where 6 visual questions will be asked. It may differ from a clinical presentation, histopathological finding, or radiographic presentation. This is a buzzer round where only the fastest one to ring the buzzer will get the chance to answer the question. 15 points will be allotted for the correct answer and -5 for the mute or wrong answer. Note, there will be negative marking in this round. The time allowed is 7 seconds after the quiz master has finished asking the question and the image is displayed on the projector. Sample question: What is the name of the anomaly shown? If the participant answers concrescence, they will be awarded plus 15 points or else -5 points for the wrong answer. The penultimate round is the syndrome and gene round. In this round, the clinical features of the patient with a particular syndrome will be presented, and all of the teams will have to answer the correct syndrome the person in the question is affected by. Also, the question might relate to a clinical presentation along with histopathological features and radiological features, and the participants will have to identify the gene the patient of the disease or condition asked in the question is suffering from. This is a transferable round where a total of 6 questions, syndromes/genes, will be asked and there will be no negative marking for the wrong answer. The team to answer the direct question will be awarded plus 10 points and the team to answer the passed question will be awarded plus 5 points. 10 seconds will be provided for the direct question and 5 seconds for the passed question. Sample question relating to syndrome. Which syndrome is associated with multiple COTS, multiple BCCs, calcified falx cerebri and nevoid basal cell carcinoma? Gorlin syndrome. Sample question relating to gene. A rare autosomal dominant condition begins in early childhood when both the upper and lower jaw enlarge as bone is replaced with painless, cyst-like growth. The teeth appear dislocated, impacted, and floating in cyst-like space in the radiograph. What is the gene that causes this disorder? SH3BP2. The final round is the rapid-fire round. A total of 5 questions will be asked to each participant. It is a kind of miscellaneous round where participants' overall knowledge regarding the subject of oral pathology is checked quickly. The time allotted will be 25 seconds, and there will be no negative marking for this round. If the participant does not know the answer or is stuck to a particular question, he or she should pass the question. Otherwise, the timer will keep running and the next question won't be asked unless some answer or pass is uttered from the participant. Each team will get 5 marks for the correct answer. Sample questions. What is the common name for schwannoma? Neurolomoma. What is the full name of the bacteria A. comitans? Aggregatibacter actinomycetum comitans. What is a medical term that indicates the ability to touch the tip of the nose or chin with the tongue called Gorlin sign? What is the motto of the Academy of Oral and Maxillofacial Pathology, AAOMP? Bringing together the best in oral health care. Name the condition where there is multiple organ involvement and a butterfly rash is seen over the bridge of the nose and is usually treated with corticosteroids. Systemic lupus erythematosus. After the conclusion of all 5 rounds, the team to secure the highest point overall will be crowned the winner of QuizMania. Note, in case of a tie, we will see the team's performance scored individually in the visual round. So, the visual round may be a decisive round in the overall quiz.